If someone tells you that they're having tailbone pain, the first thing people typically ask is, well, did you fall? Because tailbone pain is normally associated with an injury or such as a fall. But there are other times when people can have tailbone pain. Constipation is one of them. So when people tell me they're having pain directly at the tailbone, at the butt region, I always want to know about their bowel habits. Another point in time that women may experience tailbone pain and it becomes more common is during pregnancy. And that actually has something to do with the changes that are going on with the posture and the mechanics as to how she's moving related to the growing abdominal region from the uterus. We're going to talk about tailbone pain more so in relationship to pregnancy and also give you some helpful tips and tricks that may help mitigate your pain. Just to make sure that we're on the same page, I at least want to use this model here to show you exactly where tailbone pain occurs. Because when people say tailbone pain, I want them to point to exactly where they're having it so that way I know that we're talking about the same thing. So when you're saying tailbone pain, if you're seated, this is the front of your pelvis and this here is the back of your pelvis. This area right through here is going to be the tailbone. This is your coccyx. That is where tailbone pain occurs. So if you're having pain right here, right underneath your bottom, that is typically tailbone pain. If your pain is over to the sides at all through here, that is not your tailbone, and that pain may be caused by other things, especially if it's at the issue of tuberosity. So specifically, coccyx region here, that's your tailbone, and that's the area we're going to be talking about when we're discussing tailbone pain and what you can do to try to help alleviate some of those symptoms. When addressing tailbone pain related to pregnancy, I want you to understand that there are different biomechanical differences that occur in a pregnant body with the posture, with shapes, with how you're moving compared to before your pregnancy. One thing that can happen is we can inadvertently put additional stress and tension on these muscles because our body is naturally changing and adapting to the pregnancy, especially the growing abdominal region. As the uterus continues to grow, you also start putting additional stress on some of those ligaments that attach the uterus directly to the sacrum. And your tailbone is at the very bottom or base of your sacrum. So those things can cause additional tension and pressure on this area and sometimes result in pain. Let me show you a little bit using this model. That way you can see the musculature. So the pink that you see here, those are your pelvic floor muscles. Right here, that white tip, that white point, that is your coccyx or your tailbone. At this area, if you have tightness of any of these muscles, that can cause additional pain and pulling through here and make it very uncomfortable, especially as you're trying to move from a seated position to standing, or even if you're spending more time sitting down, you may notice pain in that area. In addition to that, during pregnancy, a lot of women begin to start turning their hips more outward so that way they can support and adapt to the growing abdominal region with the baby right here in the belly. That can cause additional tightness with some of the muscles that connect directly to the sacrum. And you already heard me say that the tailbone is at the base of your sacrum. So that means that you can have more tension and more taut tissues at this area contributing to your pain. So the first activity that we're going to try to see if it helps with tailbone pain and giving relief is just sitting down on a chair or even on a ball. A ball is going to allow for you to move a little bit better, but if you're noticing that you don't feel as stable or if you have a good balance, then I want you to use a chair. For the purpose of this video, I'm using a chair. That way you can at least see what the mobility looks like and then progress that to a ball if you like. So I just want you to come underneath the baby. So underneath the tummy region, you're just going to gently use your hands to lift the baby. Now I'm using a ball, so of course you're going to notice that I have a lot more lift and you're not going to get a lot of movement, but you're just going to gently offload. And what you should feel is a release of what may be pressure or even heaviness just in the lower abdominal region as you lift to support using your hands. Now, as you support using your hands, we're going to do some gentle rocks through our pelvis. And you're just going to gently move the pelvis so that way you can move your tailbone, which is right through here. Tailbone's right back here. That way you can move your tailbone up and then back down. So notice that this is just through my pelvis. So still supporting underneath the tummy. And you're just going to lift the tailbone up and back down. So very, very slow and very gradual movement. So not a lot of movement through there. You don't want to use your back. So notice when I use my back, it's a very different motion. So first, just with the pelvis lifting up and back down, going up and back down. So just doing some pelvic tilts in the anterior direction. So forward and then tucking back under, maintaining the hold here for the belly. And as you're doing that motion, I want you to take note. Are you noticing pain more so when you anteriorly tilt, when you lift the tailbone up? Are you noticing pain more so when you posteriorly tilt? So wherever you're noticing that pain, that is the area right now I want you to hold off on. So if you're noticing pain coming up, then we're more so going to work with you tilting into a posterior tilt. But if you're noticing tilt coming down, then you're going to gradually work into the anterior here, okay, as you still support the belly. Now, if pain is not something that you feel, but you feel more of a pull or tautness, you are okay to work into both of those directions right now, okay? So just going gradually until you feel a slight stretch, feeling a slight pull, and then relaxing off and gradually increasing your motion as you're able to. So don't try to do too much motion in the beginning. It's okay to start with small tilts. So still supporting the abdominal region to help hold the belly and relieve the pressure from the front pelvis. Go ahead and give that a try. So pause the video so that way you can see, how does your body respond to that? Are you noticing any relief with that? Are you noticing that what your symptoms are doing, so that way we can best adjust? So go ahead and pause the video and give that one a try, and then we'll talk about something else that you can do next. So the next activity we're going to do is using like a little massage ball. You can even use a tennis ball just underneath your bottom to gently try to massage this area. So we're going to massage the muscles. So I'll show you first on the model and then also show you what it looks like when you're sitting down. So first with the model, you're just going to place the ball in between that sit bone, so the bone that you're actually sitting on, that big bone right here, and in between that and where the crease of your buttock is. So the ball is going to go here, okay? Right through here. And as you sit on that ball, you're just going to add gentle pressure just to gently massage through that area. Now, you don't have to add all of your pressure, meaning you don't have to sit completely on top of there, okay? But you can even lean to one side, use your arms to support you, so that way you're able to gradually add pressure. So I'm going to go ahead here and place this ball just gently underneath. And now notice I am leaning to one side, and I'm just going to gently rotate on that area, doing small circles. Good. And then giving myself a break as I need to, okay? So you can try this one here on each side for about 30 seconds. And after 30 seconds, moving it to the other side. Some people also notice that they can come down towards the front region, in between where the pubic symphysis is and the adductor, so in between here as well, but not directly on the bone because that can be uncomfortable, and just gently leaning the leg in. And notice I'm rotating my knee inward and then rotating my knee outward and just gently massaging through there. So with gentle movements, rotating the leg in and out. And as you're doing this massage technique, make sure that you are breathing, taking nice deep breaths, because every time you inhale, if you're inhaling properly, that pelvic floor is going to relax a little bit. So go ahead and grab a massage ball or even a tennis ball and give this one a try. Make sure you do both sides, especially if your pain is directly in the center. Make sure you do both sides and compare each side. Is one side tighter than the other? Do you notice more tenderness on one side compared to the other? So that way you can get a better idea as to how your body is responding. Go ahead and pause the video, give that one a try, and then come back for one more thing that I want you to try on your own, which is going to be a stretch. So the last exercise that we're going to try in order to try to help you decrease your tailbone pain is something called a piriformis stretch. And I'm going to show you two different ways to do this. So the first way I'm going to show you is I want you to use your hands if you need help. Otherwise, you can just pick one leg up and cross it on top. But if you need to use your hands, please use your hands to cross it on top of the other leg, okay? Now, as you do this, you want to try to make sure the knee is going down towards the ground. If your knee starts up here and you already feel a stretch back through here, that's okay. Stop through there, and as you're able to, gradually and gently add more pressure to bring the knee towards the ground. So if your leg is here and you're still not feeling a stretch, now I want for you to lean forward. So that way we can work on stretching back through here, a muscle through there called your piriformis, which is responsible. Well, one of the motions it's responsible for is to help rotate the hips out. But you heard me mention earlier that during pregnancy, a lot of women start naturally moving into that position. So this muscle can get tighter. So this stretch here, gently pushing the knee down, leaning forward if you're able to. And I want you to hold that there for a count of 30 seconds. Still taking nice deep breaths. Make sure you're not holding your breath. And then you can repeat the stretch 30 seconds on the other side. And if you feel pretty good after the stretch, you're able to do it as much as you need to. Now with stretching, I don't want you to have pain, and you also should not have numbness or tingling that occurs. If you're noticing pain or numbness or tingling, I want you to back off. So that's the first stretch I wanted to show you. The next stretch is very similar to what we just did, and I'll do it on my opposite leg this time. With the next stretch, you're going to try to bring the leg up and over, so you need to use your arms to do that. And now I just want you, instead of letting the knee go down, now I want you to try to hug your knee. Now remember, you're going to have the baby here, okay? So your knee may stop right there because of the tummy, and that is okay. And if you need to use a strap to hook around your knee to help pull the knee up and over, then you can do that as well, using like a stretching strap or a towel, looping it around, and then pulling up this way. So trying to pull that knee towards your opposite shoulder, just to gently stretch. Go ahead and give one of those stretches a try, if not both of those stretches. And same thing as I mentioned with the first stretch I showed you, you can hold the stretch for about 30 seconds. If it feels good, go ahead and repeat it, but make sure you do both sides. And also take note, just like you did with the massage technique, how does your body feel one side compared to the other? Is there one side that feels tighter? Is there one side that's more tender? All of that information can be very helpful in you better identifying the cause of your tailbone pain and what also brings you relief. Now, the activities that we went over in this video are just a starting point, because tailbone pain can have many different causes, especially during pregnancy. And sometimes external treatments options are not the only option for you, and you may have a better option with internal assessments and treatment as well. So if you're still having pain, still noticing issues, I want you to make sure that you reach out to a local provider, so that way you can get the help and resources that you need and be able to navigate the pregnancy with less difficulty and less pain. So if you found this video helpful, please go ahead and like and subscribe. Also share it and make sure other people can get the information that they need as well.